This program is brought to you by Stanford Hospital and Clinics.
Welcome to another episode of Stanford Medical Minutes. Today we'll be talking about fertility treatments with Dr. Lynn Westphal from Stanford Medical Center. So Dr. Westphal, what's different about fertility treatment at Stanford?
At Stanford, we are leaders in fertility treatment and have been involved in many of the innovations leading to our current treatments. And we have a very talented and dynamic group of physicians, embryologists, and nurses who work together to provide the best care for our patients. And all of our physicians are very well trained. Everyone has done a fellowship in reproductive endocrinology and infertility. And I think everyone in our clinic is very well respected around the world as leaders in the field.
Let's talk about the programs and services that are offered at Stanford.
Being at one of the world's leading research institutions has allowed us to be on the cutting edge of a lot of technology, and we've been involved in egg freezing and blastocyst culture, which are two of the most recent important advances. Blastocyst culture is a technique where we culture the embryos for a longer period of time, and by doing that, we can select the embryos better and transfer just one embryo, lower the chance of having multiples, and increase the chance of having a healthy pregnancy, which is the goal of all these treatments that we do. And another technique that we are very experienced at is doing preimplantation genetic diagnosis. So in this technique, we take one cell from the embryo, and we can test the cell for many different things. For some patients, we check the cell for chromosomal abnormalities. So if someone has had a child with a problem like Down syndrome, we can decrease the chance of having another child with that. If someone is known to be a carrier of a disease like cystic fibrosis, we can test the parents for that and check that abnormality in the embryo to make sure that that is not passed on. We have also had patients who have come because they've had a child with a life-threatening illness, and the parents have wanted to have another child. And if they had a child, they wanted a child that potentially could be a match for bone marrow transplant. And so we've helped patients have another child that could be a bone marrow transplant or could potentially give bone marrow to their affected child. So we have seen patients in a lot of different situations. We work very closely with the Cancer Center, and we see patients who know that they have carriers of a genetic mutation that increases their risk of cancer, particularly things like breast cancer. So we can test embryos for these genetic mutations and allow patients to have children that are not going to be affected by these abnormalities. We have many multidisciplinary programs. Some of the programs that we've started recently have been for patients with recurrent pregnancy loss and for patients with premature ovarian failure. Many of our patients with premature ovarian failure then will look into the egg donor program and may benefit from that program.
How does somebody go about getting, if they want to have a donor, an egg donor?
If someone is interested in using an egg donor or gestational carrier, they would contact us, and then we would help them with trying to identify a surrogate or an egg donor. There are many reasons for needing an egg donor or a surrogate. Sometimes women are born with abnormal eggs or don't have ovaries, or sometimes just because as their ovaries age, they don't have good quality eggs anymore. And for a gestational carrier, sometimes women have medical conditions and are not able to have a healthy pregnancy, so they need someone else to carry the pregnancy, or sometimes they've had surgery or had their uterus removed. So there are a number of different reasons why people come to us either needing an egg donor or a gestational carrier, or sometimes both. We've had patients who have used an egg donor and a sperm donor and a gestational carrier, so we've seen a lot of different situations. So the first step is finding the egg donor or the gestational carrier. We work with a number of agencies, and the agencies will recruit women who are interested in either being a surrogate or an egg donor. And initially, the patients will look at very detailed profiles. These are comprehensive profiles of women, and it will have For the egg donors, they get a genetic evaluation, a psychological evaluation, and it has their health history, their family history, personality characteristics, extensive pictures of them, and for the surrogates, a lot of the same information. We do a medical screening to make sure that they are appropriate, and with the surrogates, most couples have a fairly close relationship with them and will usually be involved at some of their prenatal visits and go to the delivery. For the egg donor, it usually is done more anonymously, but many couples like to meet the egg donor, so sometimes they will meet in a neutral location and then the couple can see what the egg donor is like and get a sense of them. And a lot of people feel more comfortable once they actually sit in a room with someone.
Can you tell me why Stanford's good for third-party reproduction?
Stanford is in California, which is considered one of the most friendly and supportive states for egg donation and gestational carrier. Every state and every country has different laws usually regulating this, and California has always been very supportive of these techniques. So it's a very good place, and a lot of people come from other countries. We have many patients who have come from Europe and from as far away as New Zealand and Australia to do egg donation because some of these other places don't allow it or it's not as easy to access.
Tell me about the egg freezing program. I think Stanford was the first?
Stanford was one of the first in the country. We started the program back in 1998. I received a call from a father of a young woman who had cancer, and he had searched all around the country to find someone to freeze her eggs. And at that time we were freezing embryos, but she didn't want to use a sperm donor. And so we put together a program to freeze her eggs. We'd been doing research in freezing eggs, and we got approval from the university, and she was our first patient. So we started freezing eggs in 1998 for cancer patients, and then a few years later we had single women or women who didn't feel comfortable freezing embryos who wanted to freeze eggs. And so we've expanded the program and now offer it to patients who have medical reasons that are going to affect their fertility, and also women for social or other reasons who want to freeze their eggs.
So there seems to be a convergence of things at Stanford. The state regulations and the excellent staff at Stanford.
Because we have patients who come from other countries and other states to do egg donation and gestational surrogacy, we're very good at managing patients from other locations, and some of the monitoring can be done in other countries even. We have a patient right now who's coming from Europe, and she had her initial ultrasounds done in her country before she flew over here. So we're very supportive of patients who, are coming from other countries.
Would you say that you worked in partnership with doctors that are elsewhere, or?
So we have worked with physicians in many other clinics, and as long as there's someone who's willing to support the patient in their country or state, we can work with them easily. We also like to treat the whole patient, and we know that going through these treatments is emotionally very challenging. So we have Penny Donnelly on our staff who has a number of support programs, and she will discuss those. The emotional aspect of fertility treatment can be the most difficult and challenging piece. At Stanford, we're very fortunate. We have someone on site who has been doing support for our patients for a decade now. And I'd like you to meet Penny Donnelly. And Penny, can you tell us a little bit about the role that you have in our clinic and the programs that you have initiated?
Thank you. I am a registered nurse and a marriage family therapist. And so one thing that I feel like our patients are really fortunate is to have someone on staff that understands the medical components of care but specializes in the emotional component, because infertility tends to really integrate both of those. And what I do for our patients is I try to connect with as many of them as I can and get a sense of how they're coping, how they're managing, if they're depressed or anxious, If things aren't going well, I try to be there for them. In addition, we offer individual counseling, couples counseling. So many times we see that couples have a hard time being on the same page. Many people have a hard time getting the right support from others in their family or from their friends, particularly if they have young children or babies. So some of the programs that we have include support groups. Many of our groups, there's no charge for it all. We have a primary support group, and that's for women that don't have any children. We have a repeat pregnancy support group for those that have had miscarriages or a significant loss. And we have a third-party group, and that's for those that are contemplating using donor egg, donor sperm, or gestational carrier. In addition to that, we have a mind-body program, and that's a program where we explore the emotional component, but we also take a really, really focused look at how women and couples can reduce their stress. We use evidence-based stress techniques that have been demonstrated to make it better.
Can you talk a little bit about the support and the counseling that you do for people who are interested in egg donation or gestational surrogacy?
Occasionally when we see people first starting to explore their options for third-party reproduction, they're very anxious. They're not sure if it's for them, if they really want to do it, if they've waited too long, if it's too expensive. Sometimes emotionally they're not sure if they can bond or connect to a child that's not genetically theirs. So most, if not all, of our patients have at least a couple counseling sessions with me. First of all, to learn how to do the process if they opt to do it, and then to kind of walk them through the emotional readiness of it. It seems as if once people have a comfort level that allows them to move forward, it goes very smoothly. But sometimes those first steps are really scary and kind of a little bit overwhelming.
And for patients who are coming from other countries who sometimes have language issues, you've been able to meet with them with a medical interpreter?
We do. We have a medical interpreter. Actually, we have several medical interpreters of almost any language you could imagine, because we do see a lot of patients from different countries. And we appreciate that if they can communicate with us and we can understand, it makes it so much easier to find out the medical information that they need to know, and also to offer them the support that they could really benefit from.
Thank you for everything that you do.